All right, my name is Greg. I'm going to be your nurse. It looks like we have an order for you to get an IV started. I just want to ask for your name and date of birth, and while I wash my hands, they can tell me that, and I'll identify them with their wristband. I'd also want to ask them if they have any allergies, because betadine could cause an allergic reaction, or anything else maybe that I'm using the rubber tourniquet. Also, I could ask them if they'd had any previous surgeries, like a mastectomy, to see if their lymph nodes have been removed around their axillary, or if they're on dialysis or anything else like that, like blood thinner medication, anything that would cause any complications. Once I've made sure that they're okay with it, I can explain to them it's going to take about 5 minutes to do. I would first want to don gloves, which are, where are the gloves? Yeah, over here. Okay, so wash my hands. Before I don gloves, if it looks like they're going to be a hard stick, I can kind of feel around for the veins, but on this guy, these are too small, I can kind of see the vein. So I don't have to feel around too much to find it, and I should be okay with the gloves. I've already got my IV kit here on my sterile surface. So once I get these on, I'll start unpackaging those. Gotta love latex. I need to get better at this in real life. Okay. So I've got my gloves on, got my kit. What I want to do first is probably get my normal saline syringe, and I want to break the seal by pulling back on the plunger first, and that way it doesn't squirt everywhere. And then I'd want to kind of aspirate to get all the air out. Once that's done, I can connect the first part of tubing. On this end. Okay. And I can kind of flush that as well. Alright, it's flushed. I'll keep that on my sterile surface. I've got a 22 gauge needle. Since we're not giving like packed red blood cells, it's not an emergency situation, a 22 gauge should be fine on a person, especially where I can see their veins. So I can open up the rest of my IV start kit. I get my tape prepared. I'm going to rip off just a couple pieces of it and maybe split it into two. So that way, right after I get the IV inserted, I can strap it down with the tape, and I can also use a second piece of tape to kind of wrap around the bottom of it and make sure it's really secured on there. Alright, another thing that's in here is my tourniquet. So I see the vein here, I can feel it. Keeping that in mind, I'll get the tourniquet. Around this upper arm here. Get a tight tie around this. That's easily releasable, so there's a little loop I'll leave hanging here. Alright. Once the pressure starts building up, I can get my tegaderm or alcohol solution and or chlorhexidine solution, and clean the area in a circular motion where I'm going to stick it. Make sure I can let that dry. Get my needle. And I'll warn them before I stick them. And I'll let them know it's going to feel like just a little pinch. Make sure the bevel is up. I'll kind of go in vertical, and then I'll slide in. And once it's in, I can kind of separate, keep advancing it, hold it down so I don't get blood anywhere. Okay, and then I'll ask them if they can feel like a cool sensation or if it's painful or anything. They should feel a cool sensation, that means I'm in the vein. Or maybe once the saline's in, but I can screw in my syringe and tubing then. Make sure it's tight. I actually probably want to tape it first. And remove the tourniquet. Okay, so then I can give them a little bit of saline to flush the tubing a little bit more. And once that's done, I can get my other piece of tape. Make sure it's really secured on there. Looping it around the bottom. And one of the last things I want to do, once it's in and secured, is put my name, or my initials, the date, and the gauge of needle that I used on here. So it's going to be a 22 gauge. And then I can apply the Tegaderm clearly over that so it's all visible. And then we want to document. So in the documentation, I want to make sure I put the number of attempts, where I put the needle at, either on the back of the hand, the forearm, and then I want to put obviously the date and time, and how they tolerated it, and the patency of the tubing. So make sure it actually is effective. And that is how you start an IV kit.